High blood pressure is considered the leading cause of stroke, heart disease, and other dangerous health complications. Therefore, learning what to eat to lower blood pressure quickly and adhering to a healthy lifestyle can significantly help you prevent these risks. How does diet affect people with high blood pressure? Research indicates that high blood pressure is a leading cause of serious health issues such as stroke, heart disease, cognitive decline, aneurysms, or kidney failure. The latest data from the CDC shows that hypertension contributed to the death of over 500,000 people in 2018. On the other hand, many people do not realize that they have high blood pressure, making disease control more challenging. For those using blood pressure-lowering medication, there can be notable side effects such as dizziness, cramps, or insomnia. Given this situation, experts advise individuals with hypertension to follow a healthy diet and combine it with a scientific lifestyle to quickly improve their condition. Implementing a diet rich in potassium, magnesium, and calcium can help you lower high blood pressure and prevent other related health risks. Therefore, the daily diet indeed has a significant impact on the ability of patients to control blood pressure. What to eat to quickly lower blood pressure? A common concern for many people with hypertension is what to eat to quickly lower blood pressure. Here are the top 10 foods that should be included in the diet of those with high blood pressure. 1. Berries help relax blood vessels and control blood pressure. Some types of berries, such as blueberries, contain an abundant amount of flavonoids, which naturally lower blood pressure. In addition, fruits like raspberries and strawberries contain a lot of nitric oxide, which improves blood circulation and relaxes blood vessels, thereby helping to control blood pressure. Most berries also contain a significant amount of antioxidants, particularly anthocyanins. This compound has been proven in numerous studies to promote the production of nitric oxide in the blood and inhibit harmful molecules affecting the blood vessels, effectively reducing blood pressure. Research involving 34,000 individuals with high blood pressure has shown that those who consume a lot of anthocyanins tend to have an 8% lower risk of developing hypertension compared to those with lower levels of this antioxidant in their body. 2. Dark leafy greens help eliminate salt more quickly. If you're wondering what to eat to quickly lower blood pressure, dark leafy greens are an ideal choice. These foods are high in potassium, helping the body neutralize sodium. This also supports the body in expelling sodium more efficiently through the urine and the kidneys, thereby reducing blood pressure levels. Types of dark leafy greens rich in potassium that you should regularly include in your diet are lettuce, spinach, green beets, kale, Swiss chard, or collard greens. To get the most nutritious potassium, you should choose fresh greens rather than canned vegetables. Additionally, you can also eat frozen leafy greens as they contain nutrients equivalent to fresh greens and are even easier to store. 3. People with high blood pressure should eat citrus fruits. Citrus fruits are ideal foods for lowering blood pressure. Popular citrus fruits like tangerines, grapefruits, oranges, lemons, etc., all contain a large amount of vitamin C, minerals, and beneficial plant compounds. These nutrients not only help keep the cardiovascular system healthy but also significantly reduce factors that increase blood pressure. A study in Japan showed that women who regularly drank lemon water combined with exercise, specifically walking, managed to lower their diastolic blood pressure thanks to the abundant flavonoids and citric acid in lemons. Additionally, several scientific trials have demonstrated that drinking grapefruit and orange juice can effectively lower blood pressure. 4. Beetroot juice. What should you drink to quickly lower blood pressure? Research indicates that regularly drinking beetroot juice can effectively reduce high blood pressure. This effect is achieved due to the nitrate content in beetroot juice, which helps lower blood pressure within 24 hours after consumption. You can drink beetroot juice or simply cook this vegetable to eat. Additionally, roasted beets or other dishes made from beets are also ideal choices for people with high blood pressure. 5. Fatty fish and salmon. Fatty fish and salmon are rich in omega-3 fatty acids, which are effective in reducing inflammation and lowering high blood pressure in the body. Additionally, these foods are excellent sources of vitamin D, which enhances the body's calcium absorption, helps prevent depression, and improves high blood pressure conditions. Recent research has shown that people with high levels of omega-3 fatty acids in their blood typically have lower systolic and diastolic blood pressure compared to others. Moreover, this healthy fat content in the blood also helps counteract factors that promote high blood pressure. 6. Carrots can lower blood pressure. If you're unsure about what to eat to quickly lower blood pressure, carrots are a healthy option for you. This orange vegetable contains phenolic compounds such as caffeic, chlorogenic, and p-coumaric acids. These compounds are effective in dilating blood vessels, reducing inflammation, and quickly lowering high blood pressure. You can eat carrots raw or cooked to stabilize your blood pressure. 7. Tomatoes help lower blood pressure. Tomatoes are a nutrient-rich food that offers numerous health benefits for individuals with high blood pressure. Tomatoes are an abundant source of the carotenoid pigment lycopene and potassium, which help in quickly lowering blood pressure and preventing the risk of developing cardiovascular diseases. The results of 21 studies have found that regular consumption of tomatoes and tomato-based products can support rapid improvement in blood pressure levels. Moreover, they also help combat agents that cause heart disease and reduce the risk of death from cardiovascular-related issues. 8. Oatmeal porridge. Oatmeal is a food with low sodium and fat content but is rich in fiber. Therefore, eating oatmeal porridge for breakfast can help you feel fuller for longer, provide the necessary energy for the day, and support the effective stabilization of blood pressure. When preparing oatmeal porridge, you should avoid adding sugar. Instead, choose fresh or frozen fruits as accompaniments to add more nutrients to your breakfast. 9. Unsweetened yogurt. In answering the question of what to eat to quickly lower blood pressure and effectively prevent stroke, we cannot overlook unsweetened yogurt. According to the American Heart Association, yogurt can quickly lower high blood pressure, especially in middle-aged women. Specifically, a recent study has shown that older women consuming more than 5 servings of yogurt per week can reduce the risk of developing high blood pressure by up to 20%. You can enjoy unsweetened yogurt with nuts or other nutritious fruits as a substitute for dessert or as a snack. 10. Garlic is beneficial for people with high blood pressure. Garlic is renowned for its natural antifungal and antibiotic properties. Multiple studies have shown that regular consumption of garlic helps increase the level of nitric oxide in the body, aiding in the relaxation of blood vessels and facilitating easier blood circulation. Thanks to these effects, daily consumption of garlic can help patients with high blood pressure effectively manage their condition. Moreover, garlic extract has also been used to lower systolic and diastolic blood pressure in individuals with hypertension. Other methods to effectively control blood pressure. In addition to adopting a proper diet, people with high blood pressure should also implement the following methods to control their condition. Hydrate the body when there are signs of high blood pressure. Drinking 1-2 glasses of water can help reduce symptoms of high blood pressure and support restoring blood flow throughout the body. Soaking feet in hot water improves blood circulation, thereby gradually normalizing blood pressure. Practicing left nostril breathing reduces stress hormones and relaxes blood vessels, thus effectively controlling blood pressure. Pressing the Feng Qi acupoints, GB20, can reduce headache symptoms and effectively lower blood pressure. Regular exercise, such as yoga, swimming, walking, or jogging. Avoid smoking and excessive consumption of alcohol and other stimulants. Implementing early preventive and remedial measures for high blood pressure can help you limit the risk of developing serious heart-related diseases. Moreover, good control of blood pressure also helps reduce other serious health complications. What should people with high blood pressure avoid? In addition to understanding what to eat, it's also important to know what people with high blood pressure should avoid. 1. Avoid salty foods and high sodium products. Individuals should consume less than 6 grams of salt per day. This is because the sodium in salt can cause fluid retention and increase blood pressure. Therefore, those with high blood pressure should limit salt intake and avoid high sodium foods like kimchi, pickles, salted onions, etc. 2. Avoid sugary and fatty foods. Sugar and fats are high in energy and have a significant impact on health, increasing the risk of cardiovascular diseases. If you're wondering what to avoid for high blood pressure, stay away from these foods. They not only increase blood pressure but can also lead to obesity and other heart diseases. Animal offal, fast food, processed foods, smoked meats, sausages, etc., are examples of such foods. 3. Avoid instant noodles. Instant noodles are high in sodium, which can increase blood pressure and be dangerous for those with this condition. Therefore, it's best to avoid this type of food. 4. Do not use stimulants. Alcohol, tobacco, coffee, etc., can stimulate the sympathetic nervous system, causing vasoconstriction and increased blood pressure. Moreover, alcoholic substances can counteract the effects of blood pressure medications, worsening the condition. Diet can affect your blood pressure both negatively and positively. Foods high in salt, sugar, and saturated fats can increase blood pressure and harm your cardiovascular health. Therefore, it's important to limit these foods and replace them with healthier options to ensure stable blood pressure daily. An ideal meal for someone with high blood pressure includes plenty of fruits, vegetables, whole grains, and proteins. These are the choices that keep your heart healthy. Combined with exercise habits, a scientific lifestyle, limited stress, relaxation, and adequate rest, these can significantly benefit your health.